My name is Hannah. I'm going to be doing a head-to-toe assessment, and I'm going to have my patient walk in right now. Hello.
Hi.
What's your name?
My name is Jeremy Kim.
Jeremy Kim. Nice to meet you. I'm going to have a seat here. Can you tell me your age?
22.
Okay. So the general survey is that the patient looks appropriate for his age. He is alert and aware of his environment, and as I assessed his gait while he was walking in, it was normal and coordinated and it's smooth, and there was no abnormal balance. His facial expressions are appropriate for the situation and the environment, and he maintains eye contact. His hearing is appropriate and intact. His speech is articulated and appropriate and clear. His skin overall is tan and even in distribution. His nutrition overall appears appropriate, and no signs of clinical nutrient deficits are noted. Okay, so I'm going to do a head-to-toe assessment on you. First of all, I'm going to check your head and then work my way down. Okay? So it looks like his head is even and symmetrical and normal cephalic. His eyes and his eyebrows are symmetric, no signs of swelling or lesions noted, no redness. His hair is well distributed, no signs of any redness or swelling. His scalp is shiny and his hair is black. No obvious deformities noted. Let's start off with his face. I'm going to test your cranial nerves, and let's see. I'm going to have you puff your cheeks. Do the right side, left side. Can you give me a smile? Can you frown? Stick your tongue out? Okay. And then I'm going to have you close your eyes, and then say now when you feel a sensation, okay?
No. 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 No.
Okay. All right, so his cranial nerve 7 is intact, and there's no deficits there. I'm going to palpate his temporal mandibular joint, and then if you can open your jaw and close it. Do you feel any pain or tenderness? No crepitus or clicking noted, and patient denies pain. The temporal mandibular joint is smooth with no limitations. Do you have any problems with vision? Can you see pretty well? Okay.
Yeah.
So I'm gonna test your eyes. So when I look at his eyes, I can see that his conjunctiva and sclera, they're white and clear. There is no jaundice noted. I'm going to test his pupillary reflexes. If I have a pen line. I'm going to test his pupillary reflexes. See if you can look straight ahead. His pupillary reflexes are equal and responsive, about 3 millimeters. And then I'm going to have you follow my pen light real quick. So if you can just follow the movements of the pen. Okay. And then, all right. So his cranial nerves 3, 4, and 6 are intact. Extraocular movements are good and intact. I'm going to test his corneal reflex and his light to see if he has the red light reflexes. Okay. As I assess the patient, the corneas are smooth and clear with no opacities noted. Iris appears flat and regular. Pupils are round and reactive, about 3 millimeters. Red reflexes are present bilaterally. Optic disc is flat with sharp margins and with vessels present in all quadrants. Background has even color with no hemorrhages or exudates, and macula has even color. Now I'm going to move on to the nose. As I assess his nose, it is midline and even. I'm going to see if your nostrils are patent. So I'm going to close one and then go like that. Okay, and the other one. Okay, sounds good. And then I'm going to take a look at your nostrils real quick. Okay. Alright. So the nasal septum is even with no perforation. And let's see, each nostril is patent, as you could tell. And there's his nasal mucosa is moist and red, no swelling, bleeding, or discharge noted. And then now I'm going to move on to your ears. I'm going to put this on. So as I look at the patient, his external ears are even. No swelling, redness, or deformities noted. I'm going to take a look in your ear right here. Okay. Do you have any pain to your ears when I palpate that? Okay. So there's no redness, swelling, or discharge in his ears. His eardrum is shiny, translucent, and pearly gray. There's no perforation or anything like that. He responds appropriately for hearing, so his cranial nerve 8 is intact. So now I'm going to move on to your mouth and your throat. I'm going to have you open your mouth real quick and let me take a look. Okay, his teeth are intact and all present, and they're straight. There's no abnormalities to his gums or his tongue. His tongue is pink and moist. Do you have any problems with your teeth lately?
Mm-mm.
You've been okay? All right. So I'm going to test his gag reflex right now. Okay. His uvula rises, and which is appropriate. His hard palate is white with irregular transverse rugae, and his gag reflex is present. I'll put that down. Next, we're going to move on to the neck, and I see no pulsations of the jugular vein. I'm going to test your carotid pulse right now. Hmm? His carotid pulses are present. Have you had any history of any heart disease or problems with any heart stuff? Okay, so he's been fine. I'm gonna palpate his trachea and his thyroid gland and see if he has any lymph enlargements. Okay. So his trachea is midline, no abnormalities. His thyroid gland is present, non-enlarged thyroid gland. His carotid pulses are intact. I'm going to have you do some range of motion with your neck. Can you go to the side? This side? This? And then go like this. Okay? And then I'm going to have you resist. So I'm going to have you put your head forward while I push back. Okay? And then this way. Okay. And then this way. Okay. His head has full range of motion and has good strength to resistance. I'm going to be checking your heart sounds and your lung sounds next. So as I look at the patient, his thoracic cage is symmetric and he's in a relaxed posture. Spinous processes are straight and aligned. If I take a look at his back. So I'm going to take a listen to his lung sounds in the back and then do tactile firmness and other tests. So if you can take a deep breath for me. Okay. Lung sounds are clear and equal bilaterally. Now I'm gonna do some tactile fremetus palpations. So if you can just say 99 every time.
99,
Okay.
99, 99, 99, 99, 99.
Okay. All right. I'm just gonna palpate. Okay. Now I'm going to be assessing the front side. I'm going to take a listen to your heart and your lungs on the front. Okay? You can take some deep breaths. Sounds good. Now I'm going to do this again. Can you say 99?
99, 99, 99, 99, 99, 99.
Okay. And I'm just going to top this. Okay. Alright. Now I'm going to take a listen to your heart and your lung sounds. Or your heart sounds, since I already listened to your lungs. Okay. Okay, so his thoracic cage is symmetric. Tactile fremetus is intact. There's no lumps or tenderness noted. Spinous process, as I said before, is straight and aligned. His percussion over the lung fields are resonance. Breath sounds are equal and clear bilaterally on the front and the back side. Respirations are about 16. And they're clear heart sounds. S1 and S2 are heard and regular. There's no murmurs. There's no visible pulsations or heaves or lifts. Apical impulse is about at the 5th ICS at left mid-clavicular line. No thrills are noted. Rate is about 68 and regular. All right, next I'm gonna move on to your abdomen. So I'm gonna take a listen to your bowel sounds and also palpate, okay? So if I can have you actually lay down. Okay, so take a listen to your abdomen. So bowel sounds are active in all 4 quadrants. Now I'm going to be percussing and palpating his abdomen. Let's see. Okay, so I'm going to start off with light palpation. Do you feel any pain or tenderness? Now I'm going to do some deep palpation. No pain or tenderness? Okay. Now I'm palpating for your liver right now. Okay. I was able to palpate his liver on the upper right quadrant. It's not enlarged. His spleen is on the left side, upper quadrant. I was not able to palpate his kidneys, but everything seems to be within normal limits right now. He denies pain on palpation and no bruise or any pulsations noted. So his abdomen is within normal limits right now. I'm going to be checking his legs right now to see how his legs are doing, to check his pulses and the temperature, and see how his legs are doing. Alright, so I'm going to check your feel pulses. Okay. Get your legs real quick. Can you push down on my hands? Alright. With your feet, can you move your feet outward and inward? Can you flex up, flex down? Now can you get your heel to your knee? One of the heels onto your other knee and then slide down. Okay. Alright. Sounds good. Now you can sit up for a minute. So, his legs are symmetrical, hair is evenly distributed, skin is appropriate for his ethnicity, and his pulses are palpable on his dorsalis and his posterior tibial and the popliteal. His temperature is warm to touch, no skin lesions or swelling or redness noted. So as you can see, the resident was able to point his torts up and down and was able to assess his ankles, and they were able to invert and go outward as well. So I'm going to have you stand up real quick and bend your knees. Okay, so his knees are able to bend. Can you bend them backwards? All right. Okay, so his knees, there's no swelling or redness noted. You don't have any pain in your joints or anything?
Nope.
Okay. I'm going to have you walk a few feet that way. I'm just going to assess your gait. And then can you walk in a straight line back? Okay. So he was able to walk across the room. As I said before, his range of motion is intact and his balance is normal. Gait is normal. Bodily movements are voluntary, and his heel to toe walk was intact. I'm going to have you stand with your arms out, close your eyes, and then have your pointer finger touch your nose on your right hand. Okay? And then do the same with your left hand. Alright? And then I'm going to have you put your hands next to your side and then just stand for about 20 seconds. So right now we're testing his Romberg to see how his balance is. And it looks like there's no swing of motion or anything like that. And it seems intact. Okay. Let's see. I'm going to have you bend to the left, your hips to the right. Can you bend back? Alright. So his flexion is really good. They're all intact. There's no abnormalities. I'm going to assess some of your reflexes now, so you can take a seat. So with your hands, I'm going to have you close your eyes, hold your hands out, and then I'm going to put something in your hand, and you're going to have to tell me what you think this is. Okay?
Key.
Okay, that's correct. That's the key. I'm going to put something else in your hand. Don't grab it, okay? You know what that is?
A pen.
Yep, it's a pen. Okay, so his his cranial nerves are intact with his sensation, and was able to differentiate the key between the pen. And he was able to show us the finger to nose assessment, which shows his cerebellar is intact And beforehand, he was also able to show us the heel to shin and was midline and was intact as well. I'm going to assess his deep tendon reflexes, so I'm going to use this for his knee. Okay, so his deep tendon reflex on his right side is intact. Alright, so his deep tendon reflexes on both sides are intact. So everything is good. It looks like your overall assessment is pretty good. So I think that's it. Thank you for your time, and I'll see you next time.
Thank you.